Hello, everyone. So, welcome to another session with me. Today, I'll be talking basically about breast ultrasound scan. I had two breast scans today, So I said, let me do this quickly. Breast scans. Let me start with a story. Uh, Story of a friend. The friend called me up a while back, and she said she was having hardness of one of the breasts, that she would love to do, a breast ultrasound scan. Okay, so what I just did was, okay, I called one of my colleagues up and I said, okay, I would want to send someone to you for a breast ultrasound, a radiologist too, female radiologist. So I just said, do the examination and let me know how far. Okay. So the radiologist did a scan for this my friend, and then she told me the result. It was highly suggestive of a breast cancer. Initially, the friend had talked about the fact that yeah, the area was quite hard, and I had some things in my mind what could be going on, at that time. And so when this colleague of mine told me that what she saw, the scan wasn't good and that it was a breast cancer. I mean, that just confirmed, my thoughts, my suspicion when that my friend told me about all these things. Now, to cut the long story short, 2 months down the line, this my friend passed away. you know. And I kept thinking about, different things. People tend to people tend to sort of hide under a guise or cover up, whatever they're going through. For a long time, you know, until maybe it gets really, really bad. That's when they get to come out, and talk to people. I want to say this. If you're going through something, as regards your breast or anything, talk to somebody that you trust. If you know you have breast pain or you feel like there's a lump in your breast and all that, talking to the ladies now, please go for a check, for an ultrasound, breast ultrasound scan. See a doctor. Talk about it. You know, you can't just keep quiet about things like this. If you have pain in the breast, go and see a doctor. Do a breast ultrasound scan, and it's very important. If you have sisters, you know, talk about it. Go for a check. It's very, very important. Sometimes we just keep quiet about, these things until they go out of the ordinary. And then you begin to want to find solution to, things like that. But by that time, it might actually be too late. Um, I'm going to talk basically about two basic things that we see, whenever we do ultrasound scan. For the younger ladies, they could come up with what we call fibroadenoma. That's a benign breast lesion. You know, the other one is a cancer, which I talked about. So you have benign on one hand, you have cancer on the other hand, breast cancer. So there are ways we look at these things, and then we come to the conclusion about which is which. Whenever you feel like your breast is becoming funny, hard if there's a family history of breast cancer. That means you have to be checking your breasts, regularly, say once in a year. If you have the time or the chance to do that, you can do it twice, maybe 6 monthly, depending. Okay, so that you just uh, keep abreast of what exactly is going on. There are some people too, they may have family history, you know, of breast cancer. Just have to make sure you check the breast regularly. I mentioned earlier that there are ways we would check for these things. Now, if well, we do what we call mammography, mammo. For once you are 40 years and above, we do mammo. We just send patients to go for mammography. You know, ultrasound too. We do for patients basically less than 40. Um, the two imaging modalities are actually complementary, depending on whichever. Anyway, your doctor will tell you which one you would need to go for. But for younger people, less than 40, you can do the breast scan just to check. And please don't forget what I said. No matter what you feel, even if it's a breast pain, a lump you feel in your breast. The funny thing is, even when you get lump, the patients that we get to see, they just tell you that it's their husbands that observed, and noted the lump in the breast and all that, and that's why they're coming for it. Whichever way, make sure you have the breast check, which is very important. I hope I've been able to talk about, some of these things uh, effectively. Um, if you like this video, then just make sure you click that like button. Okay. You can also share this video, with your loved ones. Um, click that bell notification. Okay, the notification bell icon. Just click on it. If you have not subscribed, please make sure you subscribe so that you can be forwarding videos to you, anytime they come up. All right, I'll see you in my next video. Bye.